Hello, my name's Christy Jones and I'm the Mayerling Skin Renewal System Ambassador as well as Head Trainer. And today I'm here to show the G20 Glycolic Peel procedure. We start off with the foaming cleanser. You'll see that I am wearing gloves. When I do the peels, I usually wear gloves from start to finish. I'm adding a little bit of water to that foaming cleanser just to help me emulsify it. And then we thoroughly cleanse the whole face. You'll notice that in a normal facial peel procedure, we go down to the clavicle bone, so we do the neck as well. And cleansing and prepping the skin with both the glycolic peel and salicylic peel is very important. Dr. Ho, actually his procedure is what we follow, and prepping the skin is one of the most important steps. When we remove the cleanser, we use cool water. And we do cleanse the skin twice. So that's our first cleanse, and we just repeat. So now we've done 2 cleansers with the facial foaming cleanser, not the cream cleanser, the foaming cleanser, and we are going to now prep the skin with the isopropyl. We always gauze this in and a generous amount onto your cotton gauze. I fold the gauze into a square because I find it easier to apply, and then I start at the forehead and work my way down. Asking the client to keep their eyes closed at all times. Put a little bit of pressure on one nostril because it's quite strong, so they don't breathe it in, and work around the face. You'll notice even after 2 cleansers, when you do this, you often can get a residue of makeup, dirt, and grime even after cleansing, especially if the client tans. So we need to make sure that that is completely clean. As I said earlier in the piece, this is a really important step in making sure you're going to get the maximum benefit out of your treatment. And that is nice and clean. So that's done. So once we've totally prepped the skin with our prep solution, we're then ready to apply the actual glycolic peel. But before we do that, I'm going to put 2 eye pads on over the client's eyes. You'll notice that both solutions, the glycolic and the salicylic, they're quite fine, so they can splash. The last thing we want to do is get that into the client's eyes. Here's our nano peel, glycolic. Want to give it a little bit of a shake, and what we do is we put 1 capful into a small jar, ready to apply. Best way to apply is with a brush. You can use a mask brush, a foundation brush, whatever you wish. And again, I like to start from the forehead and work my way around. When you apply the peel, you want to make sure that you have got a lot of product on the skin. So a generous amount, working all the way down to the neck and then up the other side of the face. Once you've applied that all over the face, you're then going to take your brush and you're going to work the solution into the skin. Holding those eye pads down so none of that solution flicks into the eyes. Now I do this 3 times around, and we really want to work it into the skin. This helps the peel penetrate as well as also helps with the sensation or the tingling sensation that the client will feel. It just helps distract that a little bit for them. So the discomfort that the customer will feel through a glycolic peel is very minimal, and this brushing action really helps with that sensation. And this is my third time around. And you can see that that product is really now worked into the skin, because when we first put it on, it was quite prominent. Once we've worked it into the skin, I'm then going to just take my eye pads off and remove the glycolic solution. And then after we've done that, we repeat exactly the same procedure. So we do 2 applications of the actual peel. Again, using cool water. So this is the second application of the glycolic solution. And again, you can see that there's a nice generous amount. You can see it on the skin, and that capful is, if there is any deep creases in the client's skin, you can really push it in to those areas, making sure you get the nose and the wings of the nose. And if you hold the bottom of your iPad there, you can get right up into those crow's feet area, but still protecting the eye. This is a lovely treatment, and I have been known to do a glycolic before big events for people, so the downtime is very minimal, if any, and that's important to let your clients know. They may get minimal flaking and shedding. Mostly they will find that their skin will be glowing, rejuvenated and lustrous pretty much immediately after they've had this treatment. So that's our third time around. Then we're going to remove it exactly the same way as we did before, with the cold water. Now, it's not necessary for you to take your client's eye makeup off. So we do promote these particular treatments as almost like a lunchtime peel or treatment. So if they did want to go out to work and they wanted to have their eye makeup kept, that's totally fine. You don't need to remove eye makeup. You can work around the eyes, which is what we've done here. We've left mascara on. Once the solution and the residue of that peel is totally removed, we are then going to choose our mask. As you know, we've got 2 masks. We have an anti-stress mask and a detoxification mask. They're Mayerling based, and they're both perfect to use after either the glycolic peel or the salicylic peel. In this case, we're going to use the anti-stress mask because we want to really add some moisture into this client's skin. When we're applying the mask, we use a generous amount. We want to really soak the skin and apply as much of it as we can, because not only does it feel amazing, it also calms the skin down and helps cool the skin after it's been stimulated. Once we've applied the mask, we're then going to put a compress over the top, and we're going to leave that mask on for 5 to 10 minutes. And while that mask is on, I'm just going to explain to you a few things about our aftercare. So when you have a glycolic peel, there are some treatment procedures or at-home care that you need to follow. So you can see there I've just put that nice cool compress on there. And we'll leave that. The client needs to go home with the Mayerling Skincare Cream. This has vitamin A, D, E and C in it, hence the name. This is a concentrated formula, specially formulated for post-peel procedure. It's enough active ingredients in the cream to look after the skin and help in its skin renewal and repairing process without overloading the skin. You want to tell your customers to put all of their active and everything else aside for the next 3 days and only use a cleanser, either or, the cream cleanser or the foaming cleanser, and the Skincare cream, and an SPF. Keep themselves away from direct sunlight and wear a hat and apply that as much as they need to within the next 3 days. That's their post-peel application and home care. Okay, so it's been 10 minutes and we've left that mask on, so it's all nice and soaked in. So then now you can see that I've taken my gloves off. I usually finish the treatment without my gloves on. I find that that's a nice way of finishing, and you can add a little bit of luxe to the treatment by removing the gloves. It's a little bit less clinical, and we're not working with any of the solution now, just the removal of the mask and the Skincare. Okay, so now we're going to put a generous amount of Skincare on. And moisturize that into the neck and the face. Now, once again, you need to reiterate to your customer that it's imperative that they go home with an Skincare, and for the next 3 days use this and only this with a cleanser and an SPF. And then after 3 days you would recommend them to go back to their normal daily skincare routine, and hoping that in that normal skincare routine is a Mayerling Fort Day and Night. Using Mayerling Fort Day and Night after 3 days after a treatment really helps remove any of the surplus dead skin that the peel has created. So we really want to encourage anyone who is having the skin renewal facials to get onto the Fort Day and Night once they can. And that is your G20 or Glycolic peel from Way to Go. It's very simple. As I've always said to anyone who I train, the most complicated procedure in either of these peels is your diagnosis. You as a therapist, you need to make sure that you sit down with your client, you've done your pre-consent form and you've gone through that, which we did all off camera. So you know your contraindications, you know what you're dealing with, and that is the trickiest part. Once you have cleared all of that, you're good to go. The actual step-by-step is really simple, and you're not going to get, if you've covered all of those, dotted all your I's and crossed all your T's with the consent and your diagnosis, you won't have any issues at all. You'll just have brilliant skin.